Hello, my name is Stephanie Hueston. I'm the founder of the all-volunteer nonprofit organization Coping with Laryngomalacia. Our mission at Coping with LM is to provide support, strength, and education for families coping with laryngomalacia, tracheomalacia, bronchomalacia, and pharyngomalacia. Today, I'm joined by Dr. Samuel Engel of Coastal Ear, Nose, and Throat of New Jersey. Dr. Engel is the Chief of Pediatric Otolaryngology at Jersey Shore University Medical Center and the K. Hovnanian Children's Hospital in Neptune, New Jersey. He specializes in all aspects of pediatric otolaryngology, with particular interest in pediatric airway disorders and obstructive sleep apnea. Dr. Engel has also authored multiple publications in the field and has presented at various national meetings. Welcome, Dr. Engel, and thank you for volunteering your time and knowledge to help better educate the public on malacia.
Thank you for having me, and thank you for all the great work you do.
Thanks, same to you. Okay, the COVID-19 pandemic has tragically taken the lives of many and has caused great concern in the airway disorders community. Since COVID-19 affects breathing, are children with malacia at greater risk for developing complications from the virus?
That's a great question. Like most things about COVID, we don't really have great statistics or know a lot about it. But fortunately, as everyone knows, children are considered to be relatively spared from COVID-19, and most children have done very well that have had it. The data, mostly out of Europe, shows that children with lower respiratory disease, bronchopulmonary dysplasia, which is immature lungs of premature infants, and asthma, those children seem to have worsening symptoms with COVID because when people do get really sick from COVID, it often affects the lungs. But as far as we know, it doesn't really affect the upper airway or the large airways as much. So most children with COVID-19 don't have upper airway symptoms. And so most kids with laryngomalacia should not get sicker with COVID-19. There's always, of course, the exceptions, which is what everyone is afraid of and why we're all so careful to wear our masks and wash our hands. But for most kids with laryngomalacia, they are not at more risk than anyone else.
That's great news. Thank you. Up to 20% of children with laryngomalacia will need surgical intervention. When do you believe a supraglottoplasty is needed?
So laryngomalacia, as all of you out there know, is generally a self-limited condition, and most children with laryngomalacia will outgrow it. So what I tell my parents is that we only need to do surgery if laryngomalacia is stopping your child from doing what they need to do. And in most kids, the times that they need to have surgery for laryngomalacia is if they're having feeding issues that are not getting better with treatment of conservative measures or management of reflux. So kids that are not gaining weight or are struggling to feed. And the other common reason that children with laryngomalacia wind up having surgery is because they're having sleep apnea or other breathing issues, which is unfortunately a sign of severe laryngomalacia that would require intervention. There are some other rare indications for surgery. Kids that have severe retractions that can even lead to something called pectus excavatum, where their chest is really sucking in, or not meeting milestones. But those are the main reasons that we would recommend surgery for a child.
Perfect. And which of these surgical instruments do you use during a supraglottoplasty? Laser or cold steel, and why?
So when I do a supraglottoplasty, I do not use the laser. I use cold steel, which is sharp surgical scissors, and I also use an instrument called the debrider, which is a steel instrument that is not a laser, but I explain it's like a little Pac-Man machine, it removes some of the tissue quickly, mostly because it cuts a little bit faster. The reason that I don't use the laser is because there have been reports of scar tissue formation with the laser. And what I tell parents is less is more with surgery. When we do surgery for laryngomalacia, the goal is to get the child to breathe better so that they can feed better, sleep better, grow better. It's not necessarily to remove any floppiness from the airway, because the floppiness, the malacia gets better with time with laryngomalacia. It's to treat their symptoms. And what we want to avoid at all costs is long-term serious complications. So if you take away too much, you can't put tissue back into the larynx. It's very difficult to put back something that's been removed or to remove scar tissue. So it's better to do less and have to go back than to do too much and then have scar tissue form and then have narrow permanent scar tissue in the airway, which can then cause long-term issues with aspiration, food going down the wrong way, or go from a floppy larynx to a scarred larynx, which would then require an even bigger surgery to reconstruct it. So that's why I use cold instruments.
Great. And what are the benefits of performing a bronchoscope during a supraglottoplasty?
So the reason why pretty much all surgeons will perform a bronchoscopy at the time of supraglottoplasty is that children with laryngomalacia, depending on where you read in the literature, but many of them will have some other abnormality in their windpipe, anywhere between 5 and 65%, depending on what studies you read. Most of these are minor abnormalities that don't lead to any worsening outcome or any further troubles, but some children can have other issues. Laryngomalacia can be associated with tracheomalacia or bronchomalacia. And if you do a supraglottoplasty, that's a surgery to address the laryngomalacia, but it won't affect the tracheomalacia or bronchomalacia. So you want to know, so you can tell the parents, okay, we've addressed the laryngomalacia, but there might be some issues, or we need to look out for X, Y, or Z because we found something else. And when we do a supraglottoplasty, the surgery is done endoscopically through the mouth. So we're putting a camera down to the level of the voice box to do the surgery. So at the same time, to look a little bit further down the windpipe literally adds 30 seconds to the procedure. So there's no real increase in anesthesia time, and there's no real risk of further complications. So it's a great opportunity to rule out those other abnormalities so that we know if those need to be addressed down the line.
Great. And I know I speak for many when I say having no known cause for laryngomalacia is very disheartening. Is there genetic research being done on laryngomalacia? And if there is, has there been a genetic link found?
So that's a great question. As far as I know, there's no one doing specific research just on laryngomalacia and genetics, but there certainly is a genetic link to most diseases. There have been a few genetic causes found. There is an autosomal dominant form of laryngomalacia, which means that if 50% of your children would have it, but that's one report, and it's not something you can commercially test for. However, there certainly are families that have multiple children with laryngomalacia. Statistically, the chance of another child having laryngomalacia is only about 5%, but there are certainly genetic causes. There are certain genetic syndromes that are associated with laryngomalacia. Those are generally associated with other abnormalities as well. That's why they're better described. But laryngomalacia, though it's pretty common, 1 in 2 to 3,000 children, doesn't have a lot of genetic research or other things being done about it. mostly because the vast majority of children with laryngomalacia do really well. And it's a disease that gets better on its own without long-term ramifications. So research is focused more on diseases that are that don't have such a great outcome.
Understand. A common question that is asked in Coping with LM's caregiver support group on Facebook is, can laryngomalacia cause speech delay?
So that's a great question. For such a common disease, at least in the mild form, there's actually not a lot of long-term follow-up studies, but there is some old data from the 70s that said about 5% of kids with laryngomalacia would go on to develop speech delay, which is more common. Generally, it's thought that 2 to 3% of children have some sort of speech delay. So it seems to be a little more common in children with laryngomalacia, but not very common. And there's no real known pathophysiology, meaning the laryngomalacia itself should not affect the speech because the vocal cord mobility is normal, and the muscles of the pharynx and the larynx work normally. So as the children get better, we don't know why there seems to be a little bit more speech delay, but it's not terribly high. So most kids with laryngomalacia have no issues with speech down the road. Usually they have no issues down the road in terms of long-term complications, which is great for the kids and great for the parents, but also why some of the data is lacking, because most kids do great no matter what.
Right. Knowledge is power. What tests should parents ask for after their child has been diagnosed with moderate to severe laryngomalacia?
So testing, especially in kids, is something that we try to avoid in terms of, especially in terms of x-rays or things like that, because they expose the kids to radiation. So generally there's no x-ray test that we order unless there's significant swallowing concerns, in which case sometimes if we're concerned about food going down the wrong way, they'll get a swallow test. The other test that actually is more common that we get for children with moderate to severe laryngomalacia would be a sleep study, because one of the reasons that we would consider surgical intervention for a child is if they're having sleep apnea, which is where at night, if the baby's having issues with their oxygen level dropping down, or the floppiness in the larynx is actually blocking the airflow, then that's a reason that we might consider surgery on a child. So the most common test that we would really order would be a sleep study to check for sleep apnea, to check to make sure that that the baby's not having issues with their oxygen level dropping at night, because that could lead to long-term problems, because children that are working extra hard to breathe can have issues in terms of weight gain for one thing, and also it can also lead to extra strain on the heart and lungs, and that's something we definitely want to avoid.
Definitely. On behalf of everyone at Coping with LM, thank you, Dr. Engel, for joining us today. Your passion for raising awareness and educating the public on airway disorders is needed and appreciated. If you are in the tri-state area and would like to make an appointment with Dr. Engel, please visit coastalearnoseandthroat.com. Coastal Ear, Nose, and Throat has offices in Neptune, Manahawkin, and Homedale, New Jersey. I'm Stephanie Hueston, the founder of the all-volunteer nonprofit organization Coping with Laryngomalacia, and together we are stronger than Stridor. Have a great day, everyone.
Thank you, Stephanie. Thanks for all the great work you guys do. Have a great day.
Thank you. Thank you.